All right. It is noon, so we will get started. Thank you, everyone. Welcome to our webinar on public health in action, careers and roles across North Dakota. This webinar will explore the diverse professional landscape of public health across our state as three dedicated public health workers share firsthand accounts of their work and the tangible impact they have on their communities. Really excited for this one. My name is Mary Lizakowski, and I'm a Coalition Health Director with Foundation for a Healthy North Dakota, a nonprofit organization established in 2022 with the mission to promote health and wellness across North Dakota by working at the community level. Just a few housekeeping things. Webinar attendees are muted for the presentation. After the presentation, a link to the recording will be sent out with an evaluation survey to complete. And if you have questions, please put them in the chat box and we will address them at the end. There will be some fun questions we will be putting in the chat, so we would love for you to answer those throughout the presentation. It's a pleasure to introduce our presenters today. First, we have Cheryl Waveren, an RN who has worked at Fargo Cass Public Health since 2009. Starting as an immunization nurse, then shifting roles from 2017 to 2023, and returning to the immunization program as immunization coordinator in December 2023. She appreciates the opportunity to connect with community members of all ages and enjoys discussing the role of vaccines as an aspect of both personal and public health. And next we have Sarah Hendrickson, an RN who spent the last 10 years working for Rolette County Public Health District in Rolla, North Dakota. Rolla, I think. She wears many hats, giving immunizations, running the Health Tracks program, and overseeing the STI HIV Hep C program. Sarah is also a certified children's vision screener and most recently received her Safe Sleep Instructor certification from the Kids Network in Kansas. She is head of the Safe Sleep and Cribs for Kids campaign at Rolette County Public Health. And next we have Zach Bruns, who began his public health career while finishing his sophomore year at NDSU by jumping straight into emergency response efforts during the COVID-19 pandemic. He graduated with his bachelor's degree in emergency management in 2022 and accepted the role of emergency preparedness and response regional coordinator at the 1st District Health Unit in Minot, North Dakota in 2023. He leads the Emergency Preparedness and Response Program for the 7-county Public Health Unit. Welcome to all three of you, and I look forward to this presentation, and I will first turn it over to Cheryl. And I'm just going to switch my presentation so I can get that up for you, Cheryl.
Thank you so much, Mary. Thanks for having me, and thanks for joining our talk today. I am indeed from Fargo Cass Public Health, and I'm just going to cover who we are and what we do. We do have 7 divisions that we serve in our community. The Fargo Cass Public Health, we cover Fargo, obviously, West Fargo, and all of Cass County. We are a department of the City of Fargo Municipal Government. We're governed by the Fargo City Commission and are advised by the Fargo Cass Board of Health. Okay, so these are the 7 divisions that we have in our public health unit. I am actually only going to cover clinic services, health promotion, and public health nursing because I am a nurse and these are areas that I've either worked in or work very, very closely with. I'll probably touch on a little bit of the other departments as well. Okay, next slide. So we're going to start with health promotion. Women's Way is a program that is run here by an RN. It facilitates breast and cervical cancer screening for eligible North Dakota women. Obviously, routine health screenings are important to detect cancer early and obviously, therefore, promote health in the individuals The other aspect of health promotion is our tobacco prevention and cessation. These are individuals who go into schools and teach. They go into community centers, and then they also support individuals who are trying to quit either e-cigarettes or tobacco use. All of our educators are certified tobacco treatment specialists. Uh, then our last, no, on this slide, it's our last, we have suicide prevention and mental well-being. Once again, they are community educators. They go into schools and community centers to discuss mental well-being and then connecting individuals with resources. I do want to do a shout out for our Credible Mind website. It's a collaboration with other public health units here in the southeast corner of North Dakota. That website offers assessments and articles and webinars to help people in their journey to better mental health. Next slide. Health promotion also has a child care worker who works with our child care centers to meet a health code that is in our county. Our county requires 60 minutes of regular physical exercise for every participant in a child care center. And so she goes in and supports child care centers in teaching them what some activities could be, whether that be outdoor play or games or dancing. And then another aspect of that code is to limit juice and screen time. She partners with North Dakota Child Care Aware, and through that we offer free trainings to child care centers, and that could range from safe sleep education, nutrition, obviously exercise. And I've participated in giving some immunization uh, topics as well. And then we have urban agriculture and healthy food access. So that's where we partner with local food initiatives to really promote healthy eating in Cass County. We have an urban garden just outside of Fargo Cass Public Health that we grow vegetables. We have a garden at Jefferson Elementary School, and those students help with that garden. And then in the summer, the neighborhood takes over. We have a drop area in public health where people can bring excess produce, and then community members can come and pick up that produce here as well. Okay, next slide. Public health nursing covers many different aspects. So Ryan White is run by an RN, and that provides HIV case management for eligible North Dakota citizens. That pays for routine health checkups, vaccinations, medications, and other practical assistance to help individuals stay healthy and prevent transmission. That is run by an RN. We also have RNs in our TB or tuberculosis management and treatment. So people get tested for TB and it's found to be positive. RNs will touch base with them, educate them, and then really promote completion of treatment, certainly for active TB, but also in our LTBI population, because we certainly don't want those individuals to have active TB later in their lives. So we have RNs come alongside of them, teaching them, doing health assessments, and really supporting them so that they complete their medication treatment. And then home health nursing, actually, there's two branches of home health. We have our nursing staff who go into homes and set up medications for residents here in Cass County. They also do safety assessments to make sure individuals are safe in their homes. The other branch of our home health is our home health aides. So they go in and they offer some personal care services like light housekeeping, cooking, laundry, and grocery shopping for these individuals. Once again, the major goal of our home health is to keep people safely in their homes as long as possible. Our home health aides are CNAs, CMAs, also high school grads that receive additional training upon hire. And then our last is Fit and Strong. Sorry, I was a Fit and Strong instructor, and so super fun. It focuses on seniors with osteoarthritis. However, it's open to everyone. It's a twice a week fitness class. It centers on lower body strength training, cardiovascular, and upper body strength training. And then there's education at the end. So, having said that, next slide, I'm going to have you stand up and move your body. So go ahead. I'm going to have you progress through those slide, Mary, because there's three. That first one, forget that. I mean, eventually we'll get there. Let's do that one. Stretching, some stretching, stretching. I would definitely not recommend doing that middle one. And then way up high. Okay. Oh, yeah. Stretch your body. Moving our body is so, so important for certain, both physical health and mental health. Okay. Are you going to do some jumping jacks? Okay. I'll do a couple. All right. Oh, yes. 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 Nothing like doing a little exercise over your noon hour. Okay. Thanks so much for participating. All right. Next slide. Okay, so continuing on with our public health nursing, we have maternal child health, which once again, nurses going into homes. This is for pregnant women and then families with children under 3 years of age. They go in and they educate family members, they do resource referrals, and then they do some assessments for developmental issues that might have concerned, families might have concerns for. So they're really supporting physical, emotional development and psychological well-being in the home. Okay, so I'm going to go off a sidetrack here. We do have WIC in our public health here as well. WIC is run by dietitians, and that is for pregnant women and family members who have children under the age of 5. So really, really important program that's offered to eligible families through that. Okay, next slide. Oh, no, we're already there. School nursing. If you have a student in any of these schools here in Cass County, our schools are manned by both our school nurses and our home health aides. And so our school nurses, they administer prescribed medication throughout the day or therapies. They provide education to our students and our staff, and then obviously available throughout the day to assess both injuries and illnesses. And that's once again, we have both nurses and our home health aides. Okay, now next slide. Our public health nursing, obviously our major are our nurses, but in that division, we also have CNAs, CMAs, and our high school grads that receive training. Okay, yes, our health topic question. So, in the chat, please put your answer. What health topics are covered by public health? A, long grass, B, clean water, C, communicable disease, D, pool water, and E, all of the above. If you want to just throw in your thought about what public health is all about, I'll be completely honest with you. For what I'm talking about, it actually is only centered on one of them, and that's C. Um, Thank you. Yes. Thank you. Thank you for participating. It is. So long grass, clean air, pool water. Most of that is under our environmental health or emergency preparedness, which Zach will certainly cover later on in this hour. But yes, our environmental health are usually chemistry majors, and they go in and they care about rodents, and that's why the whole long grass, and then pool water. And then obviously the big thing for you probably know is restaurant, making sure our health, the foods that are served in our restaurants and are safe. And then they do a whole lot of education about safe food handling as well. Okay, next slide. Clinic services. So we have a family planning clinic, and it offers confidential reproductive health services for men and women. Certainly, if you have insurance, you're welcome to come here, but we also offer services for individuals who don't have health insurance. You can receive pregnancy testing, STD screening, HIV and Hep C testing. We do urinalysis, CBC, metabolic panels, and then you can get prescribed medication for birth control, HIV prevention, and then STD treatment. Our clinic services are we have nurse practitioners here, and then we have RNs, LPNs, CMAs, and then of course our lab technicians. Okay, then we have immunizations. That's me. So I am an RN, and we have clinic time where people can come and get scheduled appointments here for immunizations. But frequently I'm out and about. So I'm in homes or schools, senior centers, living places where seniors are, places of employment. I'm super, super excited because in this fall, we're going to have a mobile health van. So hopefully you'll see me driving around Cass County in our mobile van offering immunizations to our community members. And then, yes, an enrollment specialist. So we have somebody with whom you can get an appointment and they can help you sign you up for North Dakota Medicaid or any open market insurance. Okay, next slide. Because I'm immunizations, of course, I'm going to do a shout out for some immunization resources. The docket is web-based, and then there's the QR code that you can scan to get the docket app on your phone. It's a way for you to access both your personal and family immunization records. And then if you have any questions about immunizations, that bottom QR code will take you to our FargoCast Public Health Immunization resource page. Okay, next slide. Employee health. So that is a division. Our employee health is embedded in FargoCast Public Health. It serves City of Fargo employees by offering them DOT assessments, annual health exams, lab work, and return to work assessments. There's a nurse practitioner, somebody who is different from family planning, who works in employee health and is supported by an LPN and a lab tech. Okay, here we go. Last question, last participation for this aspect of the noon hour. Which of the following is a primary prevention strategy for cardiovascular disease? If you don't mind just throwing your answer in chat again, surgery, exercise, or healthy eating, medications, or rehab. And yes, it's thanks for your participation. Thank you, thank you. Okay, the answer is B. And regular exercise and healthy eating. Super important aspect of what we do in public health, really helping people, yes, stay active and better, good food choices. All right, so last slide, we just rely on a lot of different people that work here at FargoCast Public Health. We have a lot of nurses, but then we have a lot of people who have communication degrees, or as I mentioned, chemistry degrees, dietitians, and then we have people who are behind the scenes, answering the phones and sending out communication. So we have a lot of office associates as well. So shout out to our FargoCast Public Health people who work here to serve our community. And thanks for having me today, Mary.
Thank you so much. I loved the questions. Those were great. And we will next move right along into Sarah's presentation.
Great. Thank you, Mary. I'm very excited to be joining you guys this afternoon. My name is Sarah Hendrickson, and I'm an RN at Rolette County Public Health District in Rolla, North Dakota. And I'm going to share with you what public health looks like in the rural area and how we use partnerships and community engagement to help strengthen and support the health of our county. So next slide, please. So just a little bit of background for those who may not know, Rolette County is found on the northern border of North Dakota, right along the Canadian border, kind of in the middle. It's a fairly small county. It does have a couple, I don't know if you'd call them cities slash towns, but Rolla, St. John, Rolette, Dunseith, and Belcourt. And then that little insert is the Turtle Mountain Band of Chippewa Indian Reservation is housed within Rolette County, right in the center of it there. So that's what encompasses Rolette County. Next slide. Rolette County Public Health was established in 2001 to address the public health needs of Rolette County, offering services to all residents regardless of income. Its mission is to promote health and prevent disease and ensure access to essential health programs. In 2022, we moved into the old clinic, which is down in the left-hand corner, as we'd outgrown our older space, which was up in the right-hand corner, which was like a double-wide trailer that we were shoving a lot of people into. So the clinic space has been great for us. We do employ 10 full-time employees and 3 that are just WIC staff. We're governed by a board of health, and we have an offsite clinic in Dunseith where a nurse provides immunizations once a week, a syringe service program that does one day in Rolla and one day in Dunseith a week. And then pictured there is also our mobile unit, which we provide immunizations, well child visits, drug take-back events, school registrations, community events. It's really helped us to provide health services throughout the county. And so that's been a great asset for us as well. Next slide, please. So I started my nursing career in the critical care, recovery, and open heart patients, and public health wasn't really ever on my radar, but it's turned out to be a really great fit for me and something that I've become really passionate about. So listed on the screen there are different roles that I've performed in the public health world, most of which I've learned just through on-the-job training, additional coursework, webinars, online trainings. Not a lot of it came from my college or clinical experience getting my nursing degree. So my main key role at Rolette County Public Health is the Health Tracks nurse. Health Track screenings are part of a Medicaid program called EPSDT. So early periodic screening, diagnosis, and treatment for children from birth through age 21 years of age. And as part of the screenings, we do the things listed there. So immunizations, fluoride applications, hearing and vision screenings, orthodontic screenings, STI testing, and education, education, education. Next slide, please. So in order to provide education to a larger audience, a big part of what we do is just get involved in the community. So that community engagement to raise awareness for public health and the services that we provide. And that can come in all different kinds of forms. So from parades to health fairs, community flu shots. You see one of the pictures there, we're at a football game. We've done Say Boo to the Flu events where we had kids dress up in their Halloween costumes and come in. Not a lot got shots that day, but they had fun anyways. And as you can see, we like to dress up for our awareness days. So National Wear Red Day for heart health and women's health, blue, and we kind of went camo the one year for colorectal screening awareness. And if you look at our signage there, it says, "It's your duty to check your booty." I thought that was a good one. Down in the corner there, we're wearing our pajamas for National Wear Your PJs to Work Day to raise awareness for safe sleep. And then other ones were just different, summer and city parades that we participated in the past. So next slide, please. Um, Prevention services is also a key aspect of what public health encompasses. So on this screen, we have some other community engagement events. So the one in the center there with the bed is a hidden in plain sight room, and that helps bring attention to different vaping products and devices that teens may have and that parents should be on the lookout for. We attend Title I nights, parent-teacher conferences, back-to-school events to provide education and discuss healthy choices. We promote mental health as well as provide education on all different health topics from immunizations to specific diseases like Hep C, tobacco and alcohol prevention. We work with community and state partners like Safe Kids, Vision Zero, and others to put on Safety Day events. That's where all the kids are wearing the white t-shirts, where the kids learn about ATV safety, water safety, farm safety, and so much more. We have done teen maze events at the schools where kids are given a scenario and then go to different booths like sheriff's office, police, clinic staff, ambulance, EMT, insurance providers to see how their life choices have consequences and where they need to go to help solve those. We partner with the local literacy chapter every year to do a book drive, and then we give the donated books to children that participate in our Health Tracks program. Different grant funding helps us to sponsor events like bike-a-thons and bike rodeos, where we provide safety tips like sun safety, pedestrian safety, and give out bike helmets. You'll see the kids holding the little torches there in the center. This last summer, we did an event with the library and the pool. We held a summer Olympics at the pool and park to promote physical activity, and the kids got to do all kinds of different kind of Olympic related activities. They did volleyball, badminton, gymnastics, yoga and golf and tug of war and all kinds of stuff. So it's those partnerships that really help us as a rural health district to make a big impact in the community. Next slide, please. So there are multiple different ways to gain and share public health knowledge. So those professional opportunities are really important. So training such as the CDC's online self-paced learning modules, You Call the Shots, that's where I learned pretty much everything I know about immunizations. The Smiles for Life program is a national oral health curriculum that is available online and geared towards healthcare workers so that they can help incorporate oral health in the general healthcare. So with our fluoride varnish, Prevent Blindness offers curriculum to become a certified vision screener and to efficiently and effectively perform school vision screenings. State and national conferences like NACCHO, the North Dakota Public Health Conference, Dakota Conference on Rural and Public Health, and the North Dakota Immunization Conference are all coming up in the next couple months. And they're great ways not only to earn CEUs, which can be hard to find, but to see what's going on locally and nationally in the public health world. Um, Different events, lunch and learns like this event and the North Dakota Health and Human Service put on immunization and STD lunch and learns monthly usually that provide CEUs as well. All of our nurses and WIC staff have taken the Cribs for Kids training to become safe sleep ambassadors. And then, like was mentioned earlier, I went to Kansas to participate in an amazing training with the Kansas Infant Death and SIDS, the Kids Network, on safe sleep. And I got my certification to be a safe sleep instructor. And since then, I partnered with Cribs for Kids, and we've started distributing safe sleep environments to those in need in our county. So a couple years back, my nurse manager, Renee, and I attended a national conference on immunization coalitions and partnerships. And that was the first time where we really learned about the concept of a community baby shower. And that's something that we really thought would be beneficial in our community. So next slide, please. So community baby shower is something that kind of ties in those sort of certifications, the community engagement, and education. And I'm just going to talk a little bit about our experience with hosting them the last couple of years. Next slide, please. So what is a community baby shower? It's an interactive event that invites new and expectant parents, their support people, and community service providers to get together for an educational baby shower. They are designed to engage families in a fun and supportive atmosphere and to link people with resources in their community. Next slide. So last April was our first community baby shower. Rolette County Wellness Coalition, which is led by Rolette County Public Health, sponsored the community baby shower. We utilized a great community venue over in Dunseith, and we had about 41 attendees and 9 vendors. And so you'll see the pictures there kind of. We had lots of great donations and giveaways, and we were able to provide a lot of education and link new and expecting mom and families to resources. But after that event, we kind of wanted to make it bigger and better and get more people involved. And after attending the kids training in Kansas, I was able to get a toolkit for organizing a community baby shower, which was helpful for creating a timeline, delegating tasks, and budgeting. So next slide, please. A safe sleep community baby shower has an emphasis on safe sleep, obviously. And the goal is to increase knowledge and the intention of families using safe sleep, breastfeeding, tobacco cessation, and maternal mental health. And those are kind of the 4 pillars that we can work at controlling and providing support for healthy outcomes for baby. So we provide at a safe sleep community baby shower. The different things that are provided would be portable cribs, like through Cribs for Kids, wearable blankets, and lots of information. So from the Safe Sleep Academy, Charlie's Kids Foundation, the AAP, the Safe to Sleep campaign. But it also has a data collection component to it as well. So the kid or the attendees take a test. I mean, it's not really a test, but kind of a baseline for what they know about safe sleep, if they're a smoker, uh, if they have a safe sleep environment, where it be a crib, a bassinet, what they plan on using, what they plan on putting in the bed with babies. So whether that be blankets, stuffed animals, pillows, whatever. And then they go through the education and they do a post test as well. And then we can use that as data collection for, are they learning what they should be on safe sleep, and hopefully getting the resources that they need to make the best decisions for baby. Next slide, please. So why is safe sleep important? So in the US, an infant dies from safe sleep related death every how many hours? So if you want to put that in the chat, to me, it was kind of surprising when I learned about it. Anybody have any guesses of how many? So got a range there, every 1 to 8 to 15 hours. So the answer is actually every 3 hours. About 3,700 babies die every year because of unsafe sleep in the US. So SUID, which is sudden unexpected infant deaths, is the #1 leading cause of death for infants from 1 to 12 months old. And that's, pretty clear then that it's a safety concern for infants, but it's something that's preventable if you have access to safe sleep environments. So, like, if you take nothing at all from what we're saying today, I want you to take away the ABCs of safe sleep. So A is alone, B is on their back, and C is in a clutter-free crib. So, and that's for every sleep, nap time, bedtime, no matter what. Nothing else in the crib with baby besides a wearable blanket and possibly a pacifier. And that's it. Same room, separate bed. Okay, next slide, please. So then our second annual community baby shower we just had on April 8th. And these are some pictures from that. So we were able to increase vendor and service providers as well as increase community awareness. We sent invites to WIC clients, really promoted it on social media, and we did a pre-registration this year, which did kind of help us get numbers prior to the event. We brought in a couple different sponsors, Cribs for Kids through MCH, the Mickinock Enterprises in Belcourt. So this year we had 112 attendees, and we did do a little bit better job of trying to keep track of people this year, which did help. But 65 of those were primary caregivers, and so they each went home with a diaper caddy, wipes, diapers, different bottle choices, room thermometers, wearable blankets. So they got a whole supply of goodies. And as you can see, attendees had a great time. They left with a wealth of resources and products. And I just think the community baby shower is a wonderful event that I wish all mothers and new families could participate in. And I know there have been a couple out there throughout the state that have been hosted, but I'm really hoping that the concept just continues to grow and to be shared so that it can be reached in all counties across North Dakota. Next slide, please. So I hope this presentation has given you a closer look at what public health can be and a glimpse at the little things that we are doing to make a big difference in this world, to promote prevention and to help save lives. So I'd like to thank Mary and the Foundation for Healthy North Dakota for giving me the opportunity to share just a little bit of what we're doing here in Rolette County, and would love to answer any questions, or there's my email on the screen if you want to reach out later. Thank you.
Wonderful. Thanks, Sarah. Those baby showers look so fun. So fun. I will now move my screen and turn it over to Zach.
Hey, good afternoon, everybody. Thank you very much to the foundation for inviting me today to speak on behalf of the Public Health Emergency Response Preparedness and Response Program. I'm always excited to share more with everybody on what we do here. So like Mary said, my name is Zach Bruns. I run the Emergency Preparedness and Response Program here at the First District Health Unit. We're a seven county public health unit here in central North Dakota, North Central. We share the Canadian border up there. Um, but I'm based in the Minot office. So today I'm just going to share a little bit about what we do in emergency preparedness and response, and hopefully you guys can get a better understanding of what exactly it looks like here. So I'm going to go over what it is, and then I'll go over what it looks like in North Dakota, and then how it pertains to everybody on this call. Next slide, please. All right, so what is public health emergency preparedness? Well, first off, it is a federal program that was created by the United States Human Health and Human Services Department, as well as in collaboration with the CDC. So it is a federal program. There is legislature that goes into it. But what is it exactly? What do we do? So this next slide, you can go to the next slide, Mary, is going to kind of lay out the 15 things that we do in this program. So I'm going to spend a little time here on each one of these to kind of give you an idea of what they are. So the CDC developed these 15 capabilities that the Emergency Preparedness and Response Program in public health has to be able to fulfill. So the first one, community preparedness that you see there, that is essentially providing training to stakeholders, and we are identifying risks that are associated with disease, with any natural disasters or man-made disasters. We are preparing for each of those. How we do that, a lot of it is working with our community partners, a lot of it general public as well, getting them the education that they need to prepare for certain outbreaks. Sometimes it's a tornado or it's a power outage, those kinds of things. I do a lot of community presentations and education. I go into the to our colleges here, our one big college, I should say, and at Minot State, and do some presentations with the nursing staff. I go into our local meetings and provide education on what our program has to offer. I do career fairs and different booths at different events to share kind of what the program is and educate the people on what we're seeing in the disease world. Number two, community recovery is exactly how it sounds. It's getting people back into their homes. It's reopening services, reopening medical facilities, getting residents back into their facilities. That is a big piece that we do play here in the emergency response section of public health. Is we take a lot of um, responsibility for helping medical facilities, hospitals, and long-term care, like nursing homes, assisted livings, and we evacuate them. We can help their patients get to places that are safer. If there was a fire that we need to evacuate from, we will track them and push them out to different facilities that have beds available. We can also help get staff to medical facilities as well. Those kinds of things, and we're trying to get people back into their homes and their places of residence. The number three is emergency operations coordination. That is the ability to support an emergency through collaboration with other agencies through standardized systems. One of those systems that we use that some of you might be familiar with in the medical world is the incident command system. This kind of lays out who's in charge of this incident, who's going to be doing what, who is in charge of administering the vaccines or the shots, who is in charge of paying for all those things, and who's going to actually do that role. um, who is in charge of planning? How are we going to do this? How are we going to respond to this emergency? And then we're going to look at the logistics of that. Where are we going to get the things to support this emergency so that we can do what we do? Part of our main role, we are looking at infectious disease and disease outbreaks. That's kind of where this program got started, and with the anthrax attacks back in the early 2000s. But that's kind of what emergency operations coordination is. It's actually doing the work, working with the appropriate people, and doing it in a systemic approach so that we can be as efficient as possible and effective as possible. Number four is the emergency public information and warning. Some of you, I guarantee, have seen this on social media or through your phone or through the news. This is issuing public health warnings, as it says there, to the public. We are sharing information that there is an Ebola outbreak or that there is the measles increase in North Dakota right now and across the country. That's the information that we're sharing with you through these different formats, be it social media or like I said, the news. out in public somewhere, we're doing that. Um, the fifth one there is fatality management. People don't really realize this, but in public health, emergency response and public health, we are responsible for the identification and recovery of human remains and their belongings. We do that in a diligent and respectful manner uh, to get loved ones their things of their to get loved ones the things of one of their loved ones who've passed. We get their things back to their families so that they can do their appropriate burials, so they can do appropriate services for that individual, and just to get them back with their loved one. Um, we do have a team here in North Dakota that focuses on and specializes on that specifically. I'm a member of that team as well as another coworker of mine, but there's a few of us in the state that do that, and it's a service that we hopefully never have to use, but we do have it. Number six is information sharing. That's exactly what it sounds like, except this one is looking at internal partners. So we're exchanging health information such as, morbidity rates, mortality rates. We're sharing infectivity rates of a certain disease, and we're sharing that with our cross-section partners. So we are communicating with the medical facilities that we are seeing an increase in tuberculosis. And then in turn, they're reporting back to us that they're seeing a lot of people coming in with conjunctivitis of the eye, or they have some sort of condition that they're seeing in the ER. That's just an example. That's kind of what that looks like for information sharing. There's plenty of other things that we're looking for, but that's that cross-section communication of what we're seeing out in the public. Number seven, mass care. This is one that we're delving into more. This is exactly what you think of when you hear mass care is like a Red Cross shelter. This is general population sheltering. We don't so much go into the general population sheltering. We're looking at vulnerable population sheltering. So we're looking at people that have some medical issues. They can still kind of take care of themselves, but they need a little bit more care. So people that live in like an assisted living or in kind of a group home of some kind that need assistance, we can provide temporary shelter and services to them in the event of an emergency. So I think of the 2011 Minot flood, setting up vulnerable population shelters, a place for that where people can go and well, specific people can go and receive this kind of care. We do some medical stuff inside this shelter, so it's not just a general like a homeless shelter to that point. It is a little bit specialized care. So we are taking that on as well. Number eight is the one that we really shine, and this is where you would see us out in the public. We all go back to the miserable days of COVID during the pandemic, but number eight is medical countermeasure dispensing and administration. What you will think of, one thing that you can go back to is the mass testing sites and the mass vaccination sites. That is this program that leads that charge and setting up those operations. So medical countermeasure dispensing originally was designed to set up testing and administration of pharmaceuticals in the event of a large-scale attack or emergency with biological or chemical weapons. It's kind of changed now after COVID. We're kind of looking at it in a different way. We can use this dispensing to do mass dispensing of water, packs of water for people, or masks, or anything like that. But it is originally designed to dispense pharmaceuticals. So you saw a lot of that with COVID drive-through. That was this EPR program. Number nine is the medical material management and distribution. This is where we provide and manage PPE and distribute PPE to healthcare facilities. In North Dakota, we do have a medical cache down in Bismarck that this program operates. We share this material, this PPE and different medical material with medical facilities that are experiencing a shortage after they've exhausted all of their resources locally. We are able to get this stuff out to these facilities so that they can continue to provide care to their patients. Um, it's kind of exactly how it sounds. So we're sending in N95s for masks. We're sending in surgical masks or gloves. Sometimes in there, it's stuff. If a generator goes down at a hospital, we have a generator that we'll bring to that facility, and just getting those things out there to whoever needs them in event of an emergency. And sometimes it doesn't even have to be an emergency. It's just so that facilities continue to maintain their operations. Number 10 is medical surge. This is the provision of appropriate medical care to meet the exceeded capacity that they're actually able to manage. So think of, for example, a train derailment happens in your community. We the hospital is now going to get it happens. Let's say this train derailment happens in a public area next to the state fair, for example. Um, I just picked that because that's in my back door here in Minot. But if there was a train derailment, all these people are exposed to this hazardous chemical that's on that train. They are all going to seek medical care immediately. So now you have 200 people showing up to the one hospital in that community. How is that hospital going to be able to manage those people and take on all those people? So our team will help that hospital to decompress, and we'll triage people through some processes that we have. We will send the most urgent, obviously, into the hospital. We'll treat the others the best of our ability. In our clinics, or we have some triage centers and stuff that we can set up. And then we can move patients to other facilities around the state as well. And we do that through a kind of a transportation process with EMS services across the states and different contracts. So we're helping this hospital or this medical facility to be able to take on the most critical patients, and then we will take on some of the greens and the yellows that we kind of say in the triage definition. Number 11 is non-pharmaceutical interventions. So this is more, we are setting isolation and quarantine standards and protocols. If you think back to those COVID days, we are communicating with the public to social distance, to wear a mask, to do those kinds of things. This isn't, it's non-pharmaceutical. We're not intervening with vaccinations or anything like that. It's purely it's purely just basic infection control. Like I said, isolation and quarantine. You stay inside of your house, or you stay in the facility that you're in, and you isolate. And quarantine is obviously where one is in contact, but they may not have the sickness quite yet, or maybe they they're just going to monitor their symptoms to see if they progress. Those are the kind of things that we're talking about with non-pharmaceutical interventions. Public health laboratory testing, number 12 there, it is testing for public health threats. So bacterias, viruses, molds, those kinds of things. We do have a public health lab here in North Dakota. We're very fortunate to have it down in Bismarck. That lab runs all of our testing. Any hospital or medical facility that they have an internal lab, but if they have more that they need to get done or something a little more specialized, our public health lab down in Bismarck, they have a great team down there that will test those things for the public and these medical facilities. So a lot of those, if you think back to COVID, the COVID samples, when people would come in and do their COVID tests, once or twice or three times a week, those lab samples or those specimens were being sent to the lab down in Bismarck, and that's where that work gets done. Number 13 there is the public health surveillance and epidemiological investigation. This is the monitoring of disease trends. In North Dakota, we do have epidemiologists all throughout the state. We have them assigned to certain regions. I have one here in my region that does do like the contact tracing. Where were these people possibly exposed? Who did they come into contact with? What facilities were they in? What was going on? What kind of disease are we looking at here? Might it be? So that kind of helps us in the diagnosis and in where we need to implement more efforts in our public health work. Number 14 there is the responder safety and health. That is the identification of risks posed to responders and where we provide appropriate measures to protect those responders. So that is fit testing people where we gown them up and where we put them on a mask. We put a mask on them and test them to make sure that have the appropriate respiratory protection. That is making sure they're using the appropriate PPE, the appropriate equipment to keep themselves safe from an exposure to somebody with tuberculosis or something to that effect. Making sure they're not lifting too much, making sure they have the appropriate breaks and the amount of time to cool down after doing a long operation. So those are the kind of things there. And then the last one here to go finish up these 15 is volunteer management. This is exactly what it sounds like: coordination of volunteers and recruiting of volunteers. We do have a medical reserve corps in North Dakota that we're very fortunate and lucky to have. We have quite a few members. Anybody that's medically licensed or has a medical background can be a part of that team, as well as others that have some specialties we look for. But this is a team that we call upon in the event of an emergency to provide extra support to that response. So if you think back to COVID, we had a lot of National Guard that helped us respond. This Medical Reserve Corps is designed to kind of fulfill that position. And so we don't have to call in the National Guard, or we don't need to call in outside resources. This volunteer group, this Medical Reserve Corps, is able to come in and actually assist us. And we train with them regularly so that they know how to do some of our operations and what we need to get done. Next slide, Mary. All right, so the EPR program in North Dakota, I'm going to go through here in these next slides, kind of what it looks like specific to North Dakota, because across the nation, it does look quite different in some of the way that it's structured. So next slide, please. So here in North Dakota, we are one statewide system. We have a healthcare coalition. We're all in the same group, and it's all medical facilities in North Dakota are part of this if they choose to be, but most of them are on board. So our system in the PhEP program, the Public Health Emergency Preparedness Program, is designed so that there is one emergency preparedness or EPR coordinator that you see on the slide there, assigned to each region. In North Dakota, we have 8 regions. I'm the regional coordinator for the Northwest Central region, based out of Minot. And then I have a counterpart over in Devil's Lake, one in Fargo, one in Bismarck, Jamestown, Grand Forks, Dickinson, and Williston. We all kind of work together to take care of our regions. But if it is a statewide or large scale disaster, we all are cross trained and we all can go to each other's regions and respond. That's kind of where this idea of the statewide response team comes in. So each of us EPR coordinators are members of the statewide response team, but the statewide response team encompasses other people from public health agencies as well inside those departments to respond to these things. So I have a team. My team here is me and our environmental health director, and then our director of communications, who also serves as our PIO. They are part of the statewide response team for this region. And then it looks differently across the board in each region. We kind of decide who we would like to be on that team, and we are all trained in various things to be as effective as possible in this team. So we're looking at, the evacuation of facilities. We're looking at staff tracking and vehicle tracking for our assets. We are doing all the planning and the response for setting up various operations such as COVID testing and family assistance and those kinds of operations. The statewide response team then reports to, oh, sorry, Mary, if you just go back one more, sorry, that last block there, the Department Operations Center and the state EPR med cache. The Department Operations Center is where all of this coordination happens. It's all a one-stop shop kind of call center and operations center down in Bismarck. Our team down there, they communicate with us what they're seeing, what needs to get done, and what we're going to do. They coordinate that and they call us regularly. And then the statewide or the state EPR med cache is where, again, I kind of touched on this before, is where medical facilities inside North Dakota can receive PPE and different supplies to keep their operations running in the event of an emergency and not an emergency. So they can pick from that med cache what they need, and then we'll get it through a courier system to them. Okay, now the next slide. So how this pertains to you, this looks directly at the readiness level as stakeholders of North Dakota. So if you just ask yourself, I'm going to ask these questions, and then in a couple slides here, I'm going to actually have you enter it into the poll that Mary's going to do. But do you or your place of work maintain emergency response plans? And if so, are those plans exercised? These are the things that we're looking for in our role here as EPR. We look to see if these emergency response plans are, if they even exist. If they do exist, what's inside of those plans? Are they efficient? Are they something that we can implement on and something that we can enhance? And then if you have those plans, obviously, do you exercise those? So do you have them inside your own home and your own personal life for your family and friends? Do you have it for your place of work? Anything like that? That's kind of what we're looking at. Obviously, we're looking at medical facilities, most overall, but we do help with any other emergency response plans through emergency management as well. Your readiness level as well. Are you aware of the potential hazards facing your community? Do you know that the most hazardous event that could occur in your community is a train derailment, and maybe not an outbreak or a pandemic of some kind or a tornado? And do you maintain situational awareness of current hazard events? Do you know that there's an emergency going on in your community, and how involved are you? And that kind of goes into this third bullet point. Do you volunteer during an emergency, or do you act during times of emergency? Do you take action? Do you donate food? Do you serve your time and fill sandbags? Do you do those kinds of things? And then how involved are you within your own community? Because I feel like as if you're more intertwined in your community and you know people and you have the various connections, we are much more resilient to emergencies. So this is kind of what we're looking at here and how this pertains to you directly. And then if you go into my next slide here, most importantly, we are doing this work in the EPR section to ensure the best health and safety of our fellow North Dakotans and visitors to this state. So some questions here. Do you follow best health practices? Do you wash your hands? Do you cover your mouth when sneezing? Do you do yearly wellness checks, etc.? This it can go on and on. Do you get involved inside your community and know what kind of emergencies, like I said, your community faces, and are you prepared to respond to those? Because they're in yellow, you can see that I have highlighted hazard events are dangerous and they are unpredictable and often strike at a moment's notice. This is what we are planning for. We are planning for those unpredictable and dangerous moments that occur just like that with a snap of your finger. We're prepared at all times to respond to health emergencies and general natural disasters as well, and any sort of man-made disaster. That's kind of what we're here to do, but we're looking at the health overall. So if you go into my next slide here, I'm going to do some questions. So this is where we're going to try the poll, Mary.
Yes, I will pop that up right now.
All right. So out of interest and curiosity, I'm interested in your guys' response to this. So my first question is, do you have a personal emergency response plan for your household and your family?
Okay, I'm working on it.
Yep, no problem.
Um, huh, well,
Not
no,
working?
well, trying to get it. Uh, but it's not, yeah, it's not letting me like make allow it to go. Um, Weird. Okay. We might have to, we
Just due to the
might,
chat.
yeah, we might have to do that. Shoot. Sorry about
Okay.
that.
No, no problem. So in the chat, I see a couple of you put answers in there. Again, that first question was, do you have a personal emergency response plan for your household? Do you know where you're all going to meet up, you and your kids and your loved ones? What kind of things are you going to bring with you? Okay, I see a few there. Thank you very much. Some yes, some no, some kind of talked about it. Okay, great. So, as a follow-up to that question, do you have an emergency response kit assembled? Do you have a supply of your medications or a supply of different foods and beverages to drink? Do you have blankets and things stored? Sarah, I see a bug out bag and you store water. That's great to hear. See a couple more coming through. No. Somewhat, not everything, no. Yeah, and that's one of those things just to start thinking about. If you don't have anything, maybe start stockpiling some different things. I know it does kind of lean into that kind of doomsday prepper kind of thing. Doesn't have to get to that level, but there are some things that maybe we suggest getting a bit of to keep on hand in the event of something. Be prepared for, a 72-hour power outage is kind of our suggestion. Um, and then thinking to your place of employment, in my next question, does your place of employment have emergency response plans? I know there's a few of you from health on here, a few from other private businesses. Okay, I see most are yes. Okay, so to that yes, have those plans that you guys are aware of, have they been exercised? Do you guys practice them? Okay, great. I see most of you are saying yes, that you do practice them, and that is great to hear. That's what we want to hear. We're always encouraging people, and we exercise all the time and practice. We are always practicing with different agencies and developing exercises and plans to address these kinds of things. All right. So I have one more slide, a couple more slides for you here. Um, So why is this important? And this is kind of a quote I was kind of sitting through thinking about, and why do I do this? Why is this work important? So kind of a quote here. Ultimately, the condition of our health, whether it's physical, mental, or spiritual, is crucial to our resiliency towards a crisis and can drastically change the outcomes we experience as a result. And the only outcome we desire for North Dakota is to be the healthiest, most resilient state in the nation. In short, resilience relies on the good of our health, and our health is only protected by the state of our resilience. So I kind of wanted to leave that message there for all of you. That is what we shoot for, and that's something I hadn't really thought about. Why is this? I know why it's important, but why would other people think that our work is important? So that's kind of what I came up with there. My next slide is going to be some resources. These are some resources here. If you are interested in building an emergency response kit, there's some links there. And then one more slide. That's my contact information, phone and email. Always happy to talk to people out in the general public about anything that I spoke today. And thank you very much to the foundation again for having me.
Yes, wonderful presentations. Oh, and I'm gonna have to do some more training on polls, apparently. I couldn't get that to work. So I apologize for that. I am going to get my slide back up here. Um, so so people are might be hopping off, but I do have the evaluation survey in there. So if you could take that. We did have one question that came in during registration. And it is, what are some of the biggest challenges the public health units face in North Dakota compared to other states? And maybe we could start with Cheryl, and then go to Sarah, and then go to Zach. Can each just touch on it.
I think that, okay, so as Mary said at the beginning, I started in public health in '09, and I felt as I felt we had more collaboration across the state. I felt like we knew each other more, we had more familiarity. I think the pandemic kind of splintered us, and so I think just being connected across the state with other public health units has been probably my biggest challenge anyhow.
Thanks for that, Sarah.
And I don't know how it compares to other states, but funding is a major issue. We never know what we're getting from year to year and what grants we will have from year to year. So it gets very complicated.
Mm-hmm. Yes, for sure. How about you, Zach?
Yeah, I think of a couple of things with this question. Thank you for the question. The first thing is obviously everybody knows it's North Dakota, but we're a very rural frontier state. That is a huge issue that we face, especially when it comes to emergency response preparedness and planning. Those are things that we have to account for. There are people that aren't in the cities. There are people out there in the rural communities that kind of keep to themselves and do their own thing out there, understandably. So trying to connect with them. And then the other thing I would say is the buy-in. Some of the stuff that we try to offer is getting people to understand why we're doing it and actually having the mindset that it is good work that we're doing. We're not here to, attack anybody or hurt anybody. We're trying to keep, like I said in my last slide there, the health of the North Dakotans and visitors is the most important thing, and that's what we're trying to do is make everybody healthier every single day. So some of the buy-in is tough here, just because we are kind of a more conservative states, which is totally fine. It's just some of that buy-in gets to be tough.
Yes, well said by you three. Thank you so much. These presentations were absolutely amazing. I learned a lot. Really loved hearing about the emergency preparedness. Zach, it's just an area that I didn't realize all the things that you cover. So really amazing. So appreciate you three willing to be here today. And we are at 104, so we better wrap it up. Um, so I will get us to our last slide. And again, thank you to all three of our presenters and to all who could attend. To stay connected with us, you can follow Healthy Nodec on Facebook, Instagram, Twitter, and Foundation for a Healthy North Dakota on LinkedIn. Also, to join the coalition, you can visit the link to stay aware of future webinars and updates on the foundation. And there is another opportunity to scan the QR code. This is recorded, so if anyone missed it, they will be able to get the recording in the follow-up email along with the evaluation survey. So again, thank you so much, and I hope you have a good rest of your day.
Thank you.
Thank you.